Well, we're here because I have Tourette syndrome, and some of my tics. Well, most recently it was this neck one, which put a lot of pain on like this side of my neck right here. Or just constantly do this, and then I'd roll my eyes sometimes, and I have one where I go like that, and then I have some ones where like I stretch out my legs, and then like sniffing, and coughing and blinking. And then I used to have one like this, where it was like I was doing the chicken. Yeah.
How long have you had those tics?
Some of them I had longer than other ones, but like I think a majority of them I got probably like 3 or 4 years ago.
Yeah, but you were diagnosed with Tourette's when you were
8
years old, and you're 15 now. And luckily you don't have a very intense case of Tourette's.
I think it's kind of gotten worse over the years though.
It has gotten a little worse, but I think you're right in the middle of puberty, and I think that a lot of the chemical changes in your body kind of will make Tourette's worse. That's what I've heard from other parents. But we did some research and found out about the office here and the work that's being done, and so we thought it would be really interesting to give it a try, because Cole tried some medication right when he was diagnosed, and he turned into a zombie, and he's not a zombie. And so we said, that's it, we're taking him off meds. It lasted like a week, and since then we've just been monitoring his diet and keeping away from sugar and gluten and artificial ingredients. But if there's something out here that can help him with these tics, it would be great, especially as he's starting to get older and getting ready to think about college in the next couple of years. So it's pretty exciting.
All right, so I'm going to have you put the mouthpiece in.
Right.
Just stay closed on it, and then tell me what you feel, if you feel any changes.
I think like the first thing, I feel my neck kind of position back.
It does.
Because
totally
I usually without the mouth guard, I kind of have it forward, and it like puts a lot of pain on my neck, and I already feel like a little bit of relief off my neck, and I still kind of feel the urge to take, but it's much less than what I normally feel.
I apologize.
Anything you want to add?
Well, I definitely see your neck change sitting right here from where I am. It just, you put the mouth guard in and it just started going like that, which is pretty amazing. I noticed your profile's changed with it in. You have a little bit more definition. I really notice, because the sniffing with you is probably your most, I just said it and you did it, but it's your most prominent tick.
Yeah.
But I notice when you have this in, you're doing a lot less of it, and I'm wondering if you're just able to have more of an open breathing way.
Yeah.
And certainly, well, there goes your neck a little bit. I'm just really interested to see how this goes when you're not thinking about it so much.
Now, how was he today? Because I saw him in the morning, we put it in, and how was he throughout the day until now?
He was actually, his tics
fine.
were great. He was more kind of playing with this new device in his mouth, so he kept moving his jaw back and forth. He has a tendency to just always kind of be moving, but the tics definitely were reduced today, which is great. And he usually has really bad allergies, and so I'm kind of surprised you didn't flare up today as we were out and about. But I'm not going to say that this has ended your allergies, but it was pretty cool to be out today without you having sneezing fits.